Hi, my name is Dr. Ross Hauser. Welcome to Fort Myers, Florida at Caring Medical in Florida. A lot of people don't realize most nerve injuries, like if somebody's been diagnosed with radiculopathy, spinal cord problems, neuritis, neuralgia, they have weird neurologic symptoms, that most of these are due to ligament injury causing joint instability. All the nerves of the body that are important, whether it's the sciatic nerve, vagus nerve, spinal cord, run within a few millimeters of the bone. All a nerve has to do is stretch 5 to 6%. 5 to 6%, and some of the nerve impulses start getting blocked. Many nerves, by 12%, they can actually tear, or all the nerves are blocked, like all the nerve impulses are blocked. When there's excessive movements of the bone, and the nerves run within a few millimeters of the bone, obviously the nerves can be touched. If the nerve is touched, that's what's going to cause burning pain, severe pain, radiating pain, tingling, a nummy feeling, because the outside of the nerve has the myelin sheath, and the myelin sheath is needed so the nerve conduction is really fast. So if you start getting myelin sheath injury or compression, then you start getting slower nerve impulses, like slower than the person doesn't sense as well. And if the nerve is getting hit a lot, that's when you get burning pain or really sharp pain. When the bone also moves excessively, the two bones adjacent bone move excessively, that's going to cause a localized stretching of the nerve. Well, again, localized stretching of the nerve can block nerve impulses. It can degenerate the nerve, damage the nerve. When nerve impulses don't go through normally, you could get dizziness. Beside pain, you can get imbalance and a host of other symptoms. So anybody with a neurologic condition, nerve injury, a problem like a nerve problem that nobody can seem to know the cause, please look into getting an assessment for ligament injury and joint instability. The way we objectively assess this is by ultrasound. So we do dynamic stress, high resolution ultrasounds, and then of course we have digital motion x-ray where we can move the bones around and see if there's excessive movement. So for instance, if somebody had excessive movement of the shoulder, that could stretch, compress the nerves that go into the arm. So that's how we would do it. The good news is if ligament laxity, joint instability is found, and that's causing the nerve injury, it's completely reversible with prolotherapy. So injections into the ligaments to tighten the ligaments, get the pressure and the stretch off of the nerve, then the nerve impulses are normal, and then the symptomatology from that nerve completely goes away. So many neurologic conditions that people thought were completely not curable can be cured with prolotherapy.